For decades, doctors have been stuck with this incredibly dangerous puzzle. How do you safely treat high blood pressure in patients whose kidneys are already failing? This is a group at an insanely high risk for heart attacks and strokes, but the right way to help them has been a total mystery. Well, today, we're diving into a massive, landmark study that finally gives us some real, solid answers.
Okay, so here's how we're going to break this down. First, we'll talk about this dangerous blind spot in medicine that left millions of people in limbo. Then, we'll get into the incredible super study they designed to finally get an answer. After that, we'll unpack the verdict, and it is overwhelming, and see just how solid the findings are. Then, we have to talk about a really important complication involving diabetes, and finally, we'll lay out the new playbook for doctors based on all this amazing research.
All right, first things first. Let's really get a handle on the problem itself. Why was there so much confusion and, frankly, fear around treating this group of patients? So, it all revolves around something called chronic kidney disease, or CKD. It's pretty much what it sounds like, a condition where your kidneys just can't filter your blood the way they're supposed to. But here's the real kicker. Having CKD sends your risk for serious heart problems through the roof. And this slide just lays out the core problem perfectly. On one side, you have this group of people who are at an incredibly high risk for heart attacks and strokes. But on the other side, you have this massive gap in the evidence. For years, doctors were worried that if they lowered blood pressure too much, they might actually damage the kidneys even more. And because of that fear, these patients were often left out of the big clinical trials, which, of course, just created this vicious cycle, a huge, dangerous blind spot in modern medicine.
So to fix this, you couldn't just do another small study. You needed something massive, something definitive. You needed a medical super study. And how they put this thing together is just brilliant. Instead of starting a new trial from scratch, which would take forever, a global team of researchers did something really smart. They tracked down the data from 46 major clinical trials that had already been done. They then pooled the individual, anonymous health records of over 285,000 people into one gigantic data set. Just think about that number for a second. The sheer scale is what gives this analysis its incredible power.
And the way they did it is what makes this so special. This process is called an individual participant data meta-analysis, and it's basically the gold standard. See, they didn't just read the summaries of old studies. No, they went back and got the raw data for every single person. This lets you analyze everything as if it were one single gigantic study right from the get-go, which makes the conclusions so much more powerful and reliable.
So, they've got all this data, all this statistical power. The moment of truth. What did they actually find? This is where it gets really, really good.
The researchers boiled it all down to a super clear, simple question. For every 5-point drop in your systolic blood pressure, that's the top number, by the way, what exactly happens to your risk of having a big cardiovascular event? Like a heart attack or a stroke.
Okay, first, let's set the baseline. Let's look at people without kidney disease. The data here pretty much confirms what we already knew. A 5-point drop in blood pressure lowers their risk of a heart attack or stroke by about 10%. Simple enough. This is our starting point.
And here it is, the big reveal. For people with kidney disease, that exact same 5-point drop leads to a 9% drop in risk. Look at those numbers, they're almost identical. This one finding just completely swept away decades of uncertainty. It turns out lowering blood pressure is just as protective for people with kidney disease as it is for everybody else. That old fear was unfounded.
Now, whenever you get a finding this huge, the first thing scientists do is try to poke holes in it. They stress test it. So the researchers started slicing up the data every which way they could think of to see if this protective effect was really, truly consistent. First up, they checked if it mattered how bad the kidney disease was. And the result was just stunningly consistent. It didn't matter if you had mild disease, moderate, or even severe late-stage kidney failure. The benefit was still there. This was a massive sigh of relief for doctors treating those who were most sick. Okay, so what about their starting blood pressure? Surely that matters, right? Well, nope. The benefit was consistent again. And this is the really wild part. Even in people whose blood pressure was already in the normal range, or even below 120, lowering it even more still reduced their risk. This gives huge support for aiming for more aggressive blood pressure targets. So far, this story seems incredibly simple, right? If you have kidney disease, lower blood pressure is better. End of story. But it's not quite that simple. The data was holding on to one more very important, very complicated twist. The researchers had to ask, is this amazing benefit really the same for absolutely everyone with kidney disease?
Or are there some groups where maybe the story is a little different, and it turns out there's one very important group?
And here is that twist. When they split the group into those with and without diabetes, the whole picture changed. For CKD patients without diabetes, lowering their blood pressure gave them a really strong 12% risk reduction. Awesome! But for the patients who had both kidney disease and diabetes, the benefit was way smaller, only a 4% risk reduction, and it wasn't nearly as certain. For some reason, having diabetes seems to weaken that powerful protective effect.
So, let's put all the pieces together. What does this actually mean for treatment going forward? How does this change the game for doctors and their patients on the ground?
Well, it gives us a much clearer playbook. Rule number 1. Doctors can and should treat blood pressure confidently, even in the most advanced stages of kidney disease. The fear is gone. Rule 2. Aiming for lower targets, maybe even below 120, is a really good idea. Rule 3. The specific type of medication doesn't seem to matter as much as just getting the blood pressure down. And Rule 4, the big one, patients who have both kidney disease and diabetes, they need a different strategy.
And you don't have to take my word for it. This is straight from the researchers themselves. That word, attenuated, just means weakened or smaller. What they're saying is that for this extremely high-risk group, the ones with both conditions, just lowering blood pressure isn't enough. They need something more.
So, this incredible study solved a medical mystery that was decades in the making. It brought so much clarity for millions of people. But in solving one puzzle, it uncovered the next great challenge. Answering this question, figuring out how to protect the hearts of people where kidney disease and diabetes collide, that is the next frontier in medicine.